Good afternoon to all. My topic is assessment of the choroidal thickness in the pachychoroid disease spectrum. So, pachychoroid disease spectrum are a group of clinical entities that are characterized by thickened and hyperpermeable outer choroidal vessel layer, that is the hallux layer. The average choroidal thickness is around 260 micrometers, the highest being at the level of the macula. So the spectrum includes the following entities, that is the pachychoroid pigment epitheliopathy, central serous retinopathy, pachychoroid neovasculopathy, polypoidal choroidal vasculopathy, and the newly added entities, peripapillary pachychoroid spectrum and the focal choroidal excavation. The aim of our study was to analyze the choroidal thickness among the patients of pachychoroid disease spectrum and to evaluate their choroidal vascular morphology. So we conducted a retrospective study at a tertiary eye institute in South India. The EDI OCT of 79 eyes of 45 patients who were already diagnosed to have a pachychoroid from our retina clinic were analyzed for their choroidal thickness and the choroidal vascular morphology. So the choroidal thickness was analyzed and was measured in the central 3000 micrometer cut section by using a caliper tool, and then we took the average of 3 points at the level of the central macula. In the same section, we studied the choroidal vascular morphology that included the average number of pachyvessels that were manually counted and the mean pachyvessel diameter that was also measured using the calipers tool. Our results were as follows. So 76% of the population, study population, had a bilateral presentation, that is around 34 patients. Among the various entities studied, uncomplicated pachychoroid was observed to be more than the pachychoroid disease spectrum. So uncomplicated pachychoroid were characterized by thickened choroid and the presence of pachyvessels, but there was no retinal alteration. Among the pachychoroid disease spectrum, central serous retinopathy was the most common. A male preponderance was observed in our study population. The age of presentation varied among the different entities studied, and central serous retinopathy presented at a much younger age group, that is around 39.5 years on an average. And an older age of presentation was observed in the uncomplicated pachychoroid, pachychoroid pigment epitheliopathy, and peripapillary pachychoroid spectrum. The choroidal thickness ranged from 350 to 400 micrometers, average of 387.88 micrometers. The largest choroidal thickness was observed in polypoidal choroidal vasculopathy, followed by pigment epitheliopathy and central serous retinopathy. On evaluation of the choroidal vascular morphology, we were able to observe that the average number of pachyvessels were more in pachychoroid pigment epitheliopathy, followed by pachychoroid neovasculopathy and polypoidal choroidal vasculopathy. The mean pachyvessel diameter, however, was observed to be the greatest in the polypoidal choroidal vasculopathy, followed by pigment epitheliopathy and central serous retinopathy. So the result that we got on observing the mean pachyvessel diameter was similar to the results observed in the mean choroidal thickness. In our study, among the pachychoroid disease spectrum, central serous retinopathy was the most common, and the least common was pachychoroid neovasculopathy. This was similar to a study conducted by Dansingani et al. And central serous retinopathy presented at a younger age of around 39.5 years, and pachychoroid pigment epitheliopathy in the elderly age group. However, a study conducted by Rosa Dola Marco et al. Showed both central serous retinopathy and pigment epitheliopathy presented at a younger age group. The average choroidal thickness was observed to be 387.88 microns, the highest being in polypoidal choroidal vasculopathy, which was also observed to have a large mean pachyvessel diameter. And a study conducted by Veronica Castro Navarro et al. Showed that the presence of dilated choroidal vessels was a defining criterion for pachychoroid. However, the average number of pachyvessels were observed to be the highest in the pigment epitheliopathy. So, though the number of pachyvessels were greater in pachychoroid pigment epitheliopathy, the choroidal thickness and the pachyvessel diameter were more in polypoidal choroidal vasculopathy. Hence, we were able to conclude that the severity of pachychoroid disease spectrum is predominantly determined by the pachyvessel diameter and the choroidal thickness rather than the number of pachyvessels. And we also suggest that patients with uncomplicated pachychoroid and large vessel morphology be frequently followed up to look for any progression to the pachychoroid disease spectrum. These were my references. Thank you.
Thank you. Just one quick question.
Yes, sir.
Can you just describe how you took the measurements?
Sir, the choroidal thickness was measured in the central 3000 micron cut section. So at the level of central macula, we took 3 points. One is at the level of the macula, and a 0.1500 micrometer nasal to it, and a 0.1500 micrometer temporal to it. And then we took the average of these 3
You did
points.
the segmentation yourself?
Yes, sir.
The readings
The readings I measured it.
you
myself.
measured?
Yes, sir.
You're confident about it?
Sir.
Good. Thank you.
Thank you, sir.